Good morning, everyone. We'll begin today's COVID-19 press briefing with Mayor John Cooper and Dr. Gil Wright, Interim Director of the Metro Public Health Department. We will also hear from Dr. Julie Gray, the Assistant Dean of Meharry Medical College's School of Dentistry, and Bill Herbert, Director of Metro Codes. Also here to help answer your questions today are Director-in-Chief William Swan of the Office of Emergency Management and Nashville Fire Department, and Chief John Drake of the Metro Nashville Police Department. We'll now begin with Mayor Cooper.
Good morning, Nashville. It's New Year's Eve, and let's talk about the end of 2020. It's been a hard year for everyone, and just when we thought we couldn't possibly find any more strength, we did. Today, I want to talk about the Christmas Day bombing, and then I want to talk about COVID. Business residents and employees who live and work downtown experienced a heartbreaking loss on Christmas morning. Although we don't know the true extent of the damage just yet, Bill Herbert, Director of Metro Codes Department, is here to tell us what we know so far. Out of this disaster, our priority is to try to make residents and businesses whole. And Metro is working to get business owners and residents back into their properties as quickly as possible, and to assist those who've lost their jobs. By tomorrow, business owners and residents will have had the opportunity to view their properties and assess the extent of the damage. Now, shortly after the bombing, I asked Governor Lee to request an emergency declaration from the federal government, and he submitted the request very promptly. And that request is now moving through the process at the White House and is headed, I believe, for signature. If approved, Metro will be eligible for federal money to pay for things such as debris removal, sewer line repair, and public safety personnel. But we also want affected businesses and residents and employees to receive federal assistance. The FBI Victim Services Division is offering assistance for victims, which includes help with medication, replacing driver's licenses, and other necessities to help navigate this moment. You can reach the FBI Victim Services Division at 901-747-4300. And additionally, my office and the United Way have launched the Restore the Dream Fund to raise money for those hurt by the bombing. These funds will be used to help individuals meet their basic needs, employees who are out of work due to the blast, and residents whose homes were destroyed will be eligible for assistance. Those who were affected by the bomb and need immediate assistance should call the United Way at 211 or visit 211.org. Now, for those interested in donating, please visit the United Way's website or text RESTORE20 to 41444. Now, the Community Foundation of Middle Tennessee, in partnership with News Channel 5, has also established the Nashville Neighbors Fund to meet both the immediate and long-term needs of those affected by the bombing. As of today, both funds have raised a combined total of $174,000. Now, AT&T tells me they restored their wireless network on Sunday, and Metro departments are working closely with AT&T to address remaining phone and internet outages as quickly as possible. Thank you to AT&T for their unprecedented work to restore services for Nashvillians. But today we should celebrate our Christmas Day heroes, our angels in uniform, to the uniformed officers who cleared the area before the blast, to the fire personnel who contained the blaze, and to the EMS responders who treated the injured. You have the thanks of a proud city. We will reclaim and rebuild historic downtown Nashville, and in fact, we've already begun, and we will rebuild like we've done all year by working together. Whether it is after a tornado, a derecho, or now a bombing, Nashville comes back stronger. And now I want to provide you with the latest on Nashville's continuing effort to combat COVID-19. Nashville's vaccination process has started. The ramp up, however, has been slower than anticipated. After a few weeks, only 10,955 of our Phase 1A1 recipients have received their first dose. To put that figure into context, there are 55,000 people in Nashville that fall under the 1A1 designation. That's the highest priority for COVID vaccination. Now, this group includes our uniformed first responders and our high-risk healthcare workers. Now, the Tennessee Department of Health also indicated yesterday that tens of thousands of vaccine doses were delayed. And all of this means that Davidson County does not have enough vaccine right now to cover the entire 1A1 group. The timeline for vaccinations for subsequent groups will likely be delayed. Now, Metro has the personnel and infrastructure to administer vaccines as soon as more becomes available. Hospital systems in Nashville have begun vaccinating their frontline staff with their first doses of the Pfizer vaccine. And Metro Public Health and the Office of Emergency Management began immunizing first responders, including healthcare workers, at our community assessment centers. And on Monday, long-term health facilities in Davidson County began vaccinating their employees and residents. Last week, the CDC recommended an expansion of the number of people covered in the subsequent Phase 1B, which is scheduled to begin in February. The CDC recommends that seniors 75 and older and frontline essential workers should be part of Phase 1B. 1B essential workers will include grocery store employees, utility and infrastructure workers, and K through 12 teachers and support staff. Now, widespread immunity from our vaccine program will take several more months. And in the meantime, we can't let down our guard. We have to slow community spread to give our healthcare workers some relief. The rollout of the vaccine program will take months, and we are still vulnerable. With 494 active COVID hospitalizations, our hospitals have the highest number of patients since the start of the pandemic. Today, Metro Public Health is reporting 6,831 active COVID cases in Nashville. But now this figure is down from 7,600 2 weeks ago. Now, since yesterday, 1,168 new cases were reported, bringing the total number of cases for the year in 2020 to a staggering 68,812. So remember, masks, social distancing, and limiting gathering to 8 or fewer people will slow the spread of the virus while we wait for the vaccine. Now today, Dr. Gil Wright, Interim Director of Public Health, is here to discuss our vaccine strategy, how Nashvillians will be contacted to receive the 2-dose vaccine, and what to expect when you arrive to get immunized. It is also my pleasure to welcome Dr. Susan Gray of Meharry Medical College, who's here to talk about our testing sites, volunteers, and staff members. And finally, Bill Herbert from Codes is here to provide an update on Metro's efforts to assess and rebuild the historic 2nd Avenue. Now, Bill Herbert has a fascinating Nashville story. He's the head of Metro Codes, and his family were early settlers in Nashville, and they worked in the brickyards that made the bricks that built 2nd Avenue in the first place. Most of the buildings on historic 2nd Avenue North were built with bricks from a brickyard where Thomas Herbert Sr. worked. Now, Nashvillians join the world in being eager to turn the page on 2020. This has been an unprecedented year in our city's history. It has been a hard year, but 2020 has also brought out the best in us. And this week, for our final Community Hero of the Week in 2020, we recognize the brave and heroic first responders who put their lives on the line to evacuate residents from their homes on 2nd Avenue, and those who fought to contain the blaze after the bomb was detonated. They kept Nashville families safe on Christmas morning. So today we honor and thank the hundreds of first responders and public safety employees who were there for us when we needed them. Nashville want to know how people all over the country have called and asked me, how did you keep moving in a year like this? And I tell them all the answer is simple. If you're looking for a reason to have hope, look at Nashville. Our music might make us famous, but our people make us strong. Whatever we face in the new year, we will face it together, committed to working together and to lifting one another up, as we always do in Nashville. Now I'll turn it over to Dr. Gil Wright from Metro Public Health.
Thank you, Mayor, and good morning. Here's the latest on the coronavirus in Davidson County. Active cases are currently 6,831. At our latest update on December 22nd, we had 7,668 active cases. Our total cases to date are 68,812. New cases since yesterday was 1,168. A majority of these cases were from tests that occurred on Monday after the holiday. The rolling 14-day average for new cases is 593, and our 7-day average of new cases per 100,000 residents is 77.1. Last week was 102. We are currently 48th out of 95 counties in disease activity. Our 7-day positivity rate is 15.1%, and last week was 16.5. Total tests done in Davidson County year to date is 804,989. And last week, tests were 39,125, which was very robust for a holiday week. To date, unfortunately, 453 Nashvillians have died. Currently, the transmission rate is 1.01, and at our last briefing, it was 1.23. While those numbers are encouraging, our hospitals continue to see more patients. Hospitalized patient counts in Middle Tennessee currently are 976 cases, and in Davidson County, 550. These are the highest hospitalization numbers since the pandemic began, and it's putting tremendous stress on our hospital systems. We're in contact with the hospitals, and they report they're tight, but they are keeping up for now. Currently, Davidson County is in the 1A1 vaccine phase. This includes high-exposure healthcare workers who are getting vaccination through their hospital systems. Also, it includes residents and staff of long-term care facilities who are being vaccinated through local pharmacies in a joint federal-state program. And Metro Public Health Department is vaccinating our first responders. The state reports almost 11,000 doses have been administered in Davidson County. Additionally, about 6,500 doses went to people who work in a Davidson County hospital but live in the surrounding area. The state reports that we have given the first dose to 1.58% of Davidson County residents. That is the third highest in the state. We have not received our next shipment of vaccines. And as a reminder, the federal government allocates to the state, and then the state allocates the vaccine to Davidson County. I am in regular contact with Davidson County Department of Health to get updates on when we will receive more vaccine. As the mayor said, the state is also phasing in vaccines for those over 75 years of age. Currently, based on the amount of vaccines we have, we're not in that phase yet. However, once we receive additional vaccine, Metro Public Health will begin to administer these doses. We will communicate and keep you informed when we begin to vaccinate this phase. We have more information on vaccines, including our current phase, on our website, covid19.nashville.gov. As a reminder, the community assessment centers are closed today and tomorrow for the New Year's holiday. They will reopen on Monday at 8 a.m. However, please check. The hours may be adjusted for inclement weather. Finally, I know we now have vaccines going into arms, and this is exciting, but we still have many thousands who need to be vaccinated. So we have to be vigilant and not let our guard down. We need to continue to do our part. We need to stay apart, wear a mask, keep a distance in public, and wash our hands. Finally, if you have any concerns about being exposed, especially after the holiday weekend, please get tested. Now I'd like to introduce Dr. Julie Gray.
Good morning, Nashville. I'm Dr. Julie Gray, Dean of Student Affairs at Meharry Medical College School of Dentistry, as well as the Nissan Assessment Community Site Leader. Today, I'd like to share my experience with you concerning the COVID-19 vaccination. Last Wednesday, our Meharry staff members that operate the 3 community assessment site for Metro were vaccinated for the COVID-19 virus. Assessment team members were excited from the moment that they became aware of the city's availability of the vaccine and were grateful to be vaccinated right before the Christmas holiday. It was a wonderful gift for each of us. The process for vaccination was seamless and very well organized. Our staff has provided very positive feedback regarding their experiences and continue to serve our Nashville community as well as surrounding counties with the same dedication as we always have. Assessment site staffers have courageously been on the front lines of this pandemic since March of this year, testing our community. As health caring professionals, we have fearlessly run to meet our pandemic with thoughts of our well-being. Each day, our team sacrifices the health for the public and are exposed to this contagious virus. As our COVID-19 cases continue to increase, we continue serving our community with the same passion as we did in the very beginning of the pandemic. Taking the vaccine does not negate the use of masks or frequently washing your hands. Please remember to social distance. This does provide us hope for our future. I am confident that together our community will continue to be kind to each other while we continue to do good things and love our neighbors by wearing masks, social distancing, and diligently washing your hands. The unwavering spirit and resilience of our community during this pandemic and Christmas tragedy symbolizes who we are as Nashvillians. Continue to be safe, Nashville, and have a happy new year. I now welcome Bill Herbert, the Director of Metro Codes.
Good morning. In the days immediately following the explosion, the areas affected by the bomb were under federal jurisdiction, and Metro Codes was not given access to those buildings. As of 3:30 yesterday afternoon, federal authorities released jurisdiction to Metro. The focus of Metro Codes is now to assess the buildings for both safety and for FEMA for those persons who may require federal assistance. Since yesterday afternoon, building inspectors for Metro Codes have assessed all affected properties in accordance with FEMA guidelines. This morning, we will continue inspecting and assessing affected buildings to determine whether they are safe for entry as well as for general use and occupancy. We expect to complete those inspections today. Though Codes does not have structural engineers on staff, we have partnered with structural engineers to assist us with the assessment of buildings to assess structural integrity. We will work with property owners to expedite permits for the rehabilitation of the vast majority of the affected buildings. Likewise, we will work with the property owners for those few buildings for which demolition may be required. Because this area is so precious to Nashville for both historic and aesthetic reasons, all permits for both rehabilitation and for demolition will be reviewed and approved by both the Planning Department and the Historic Commission prior to the issuance of that permit. Thank you.
Thank you, Bill. We'll start taking questions now. The first is Dennis Ferrier with Channel 17. Dennis, good morning. I don't hear anything. We'll move to the next one. Dennis, we're going to try to come back to you. I'm not getting any sound. Up next is Nikel Smith from Channel 2. Go ahead, Nikel. Where's the speaker? we're still working through getting the sound. Hold just for one moment. We're going to work through the sound, and then we'll begin with questions shortly. So we're going to try again. Dennis, are you there? Good morning.
Each other, but you couldn't hear us. I don't know if that's of any value, but I'll go ahead with my question.
Thank you, Dennis.
Yeah, thanks, Brian. So my question for Mayor Cooper, if restaurants and bars are following guidelines, distancing, masks, capacity limits, why not expand their hours? This is a question just about hours. You would agree that a restaurant at 50% capacity at 9 p.m. is no safer than a restaurant at 50% capacity at 11 p.m., but it allows these places to completely turn over at 50%, which would really help them, especially, during the holidays like this and New Year's Eve.
Thank you, Dennis. I think there are a couple of people that could answer that as well.
I'll go briefly, and then let me turn it over to public health that's actually working so closely with all these establishments to make sure that their staff and customers are safe. And the thing for us to realize is despite the vaccine showing up, this is not over. And as many people say, this is actually the most vulnerable moment in the entire disease. Our level of community spread is the greatest. The number of Nashvillians that have it is the greatest. The ability to overstress our hospital system, frankly, is the greatest right now. So we can see the end, but we are not at the end. And if we don't take this as seriously as we have always taken it, frankly, our mortality rates will go up. A lot of people have said expect as much mortality in the future as we've had in the past. That is an unacceptable amount when we have the ability to reduce that level. And we're talking about potentially saving hundreds of lives by restraining the level of the disease in the community. And then with that, the public health department, I know, has worked tirelessly with the industry to have every ability to keep our economy open while diminishing the level of disease.
Thank you. Mayor Cooper, I would echo what Mayor Cooper said. We are working very closely with the industry to try and mitigate, protect both residents as well as staff and employees of these facilities. We are at our most vulnerable time as people begin to get vaccinated and thinking that this is the end and potentially being less careful. But there's continues to be very large community spread. And at this point, based on our epidemiologists and our ongoing observations, we feel that this is the best way to protect the community at this point.
Thank you, Dr. Wright. Also, that is a good question, Dennis, because we do want to reiterate to everybody that restaurants and bars can be open at 50%, up to 100 people per floor with social distancing in mind. And for tonight, that means you can enter a restaurant as late as 10 o'clock, last calls at 10:30, and then restaurants, bars would be closed at 11. Thank you for helping me remember to remind everybody what those hours are. Our next question is from Nikel Smith from Channel 2. Nikel?
Good morning, everyone. Thanks for taking our questions. My first two questions are for Mayor Cooper. I'm sure you're aware of the reports saying that Metro Police were made aware last year that Anthony Warner was building a bomb. This was August of 2019, and they tried to make contact with him and were unable to do so. And in the end, there was no crime committed and so on. So my question is for Mayor Cooper, do you think Metro Police should have done more with regards to Anthony Warner when they first got that report last year, and were made aware of his ability and to make a bomb and that he was possibly doing so. My next question, the American Muslim Advisory Council posted to social media in response to the bombing, saying that the FBI's see something, say something only applies to Muslims and brown people. What's your response to that, Mayor Cooper? And do you feel it would have made a difference if Anthony Warner were of a Middle Eastern background? And my final question is for Chief Drake. It's New Year's Eve. Is Metro Police making any additional preparations as far as safety is concerned for anybody who's going to be going out? And what's your message to the community if they feel on edge about going out on New Year's Eve? Thank you.
Thank you. Thank you, Nikhil. We'll start with Chief Drake.
Thank you for that question. So we feel that we've done everything that we could do, but we're still going to evaluate our procedures and to try to identify any gaps. So I'm ordering an incident after action report. That would take us from the initial call that was made back in August, and we can critique the entire thing to see if there was anything that we could have done better. We've also reached out to different colleagues around the country who say the same thing, that we've done all we could do other than violate this person's rights. And so that is not something that we wanted to do, but we will look for any gaps. Secondly, we do have plans for this evening. We have 140 officers in addition to what we normally have for mask enforcement to make sure that it's safe for downtown. So we are taking the appropriate measures. Thank you.
And thank you, Channel 2, for those two questions, I guess, for me. Should we have done more? And I found myself going, well, you know, hindsight is 2020, and then I realized we're at the end of 2020. It is 2020, and I know the chief is committed to a professional and transparent process to make sure that we learn from this and we're better at response. I've also asked the FBI and will ask the TBI for their opinion. I've asked numerous other parties for their opinion. This is a hard space. There are lots of rules. I know the department is dedicated to applying the law equally to all parties. And but this may be a challenge that America will keep facing, and so we have to be excellent at knowing how we respond to it and do a good job. But I know the chief is committed at the end of this to a professional, transparent report, an after-action report, and to be able to answer what we've learned from this and how we're going to be even better. Now, as for the American Muslim Advisory Council, my answer is not here in Nashville. We're going to make sure that nobody feels that way here in Nashville. Equal justice under law for everybody. Everybody's going to be treated the same, and that's not going to be true in Nashville. And I know the chief and our department joins me in making sure that that's a priority for the year.
Thank you. Our last question is from Yoon Jong from the Tennessean. Good morning, Yoon.
Good morning. Going back to the vaccination, does the city have a plan in place, and be working with the school district on notifying about that? And then can we go into detail about what case investigations for positive cases look like in your, how many contact tracers do you currently have? Whatever budget was made for more to deploy more contact.
You were breaking up. I'm hoping you can repeat those questions because I couldn't understand everything you were saying. I'm sorry.
Can you hear me now?
Yes, I can hear you better.
My first question is about vaccines. Does the city have a plan or will you work with MPs on notifying teachers about vaccination? My second question is about contact tracing in the new year. Can you confirm how many contact tracers we have, what their emphasis and focus will be on, if the health department ever made additional requests for contact tracing. Thank you.
Thank you, Yoon. We'll have Dr. Wright answer those questions.
Yes. Thank you, Yoon, for those questions. I'd like to speak first to the contact tracers. We currently have over 90 contact tracers. We have kept all of our Spanish-speaking contact tracers so that we have very good ability for the people that English is a second language, and to be able to reach out to them in particular. But the other thing about what we're doing is we've actually just modernized by using a application where we can reach out to individuals electronically and have them fill out the same exact information that we spend time working through with them. This allows us to get the results back, still use those results to drive our public health processes and direction, but at the same time, it allows us to free up some of our contact tracers and epidemiologists to work more closely on clusters, such as those that may happen in schools or otherwise. It also allows us to focus on those individuals that are at the most risk, such as long-term care facilities, jails, and others, so that we can use our staff in a more effective and efficient way. The vaccine. We have a very detailed plan. Our plan is based off of the state's plan. It is a little bit in transition because the state just announced a new plan yesterday. But we were aware of that and have already started on that. As we said, we're in 1A1. Teachers fall into 1B. That will be right after we do all of the other healthcare workers. And we have a detailed plan to be able to reach out to the schools, both private and public, and notify those individuals when it's their turn, when we have vaccine. We always want to make sure we have adequate vaccine to get them vaccinated. We're also working closely with our hospital systems and hopefully we'll be able to leverage our partnership with them to be able to put vaccines in arms more quickly as we get vaccine that is available.
Thank you, Dr. Wright. Those are all the questions we had this morning. I'd like to thank Dr. Julie Gray for joining us today. And as always, we're grateful to Amy Lankite and our partners at the Bridges for the Deaf and Hard of Hearing for providing the ASL translation at these press briefings. The next COVID press briefing will air on Thursday, January 7th, 2021 at 9:30 a.m. Thank you for joining us, and this concludes today's briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.